So this is the Sand Hospital.
Well, the thing is, once they get the
Hello. Here we have control panel. It's a excellent nursing sister over there, coming in, dedicating her weekend to saving legs
just
and
designed,
limbs.
yep.
Absolutely. And here is our not so very complicated operating theatre. Looks a little complicated, doesn't it? It's got a lot of equipment. I'm going to walk through and just explain all the equipment. This is just a few monitors we have to write things down. It's an old-fashioned telephone there. And you can see the patient's vital signs inside here in the control room, which is handy. So you've got, up the top you've got the heart rate, little ECG trace, got the blood pressure there. That's straight from an arterial line that measures the patient's blood pressure directly. The next one is an oximeter, so it's 99%. And then you've got a very sophisticated CO2 monitor, which is very helpful to monitor breathing and conscious levels. And then you've got extra monitors to show you what's happening inside the operating theatre. There's our friendly anaesthetist over there. A special device here called an NG-Jet device, which is a thrombolysis device that pumps urokinase, which is a clot-busting medication, into the patient. And there's our setup. All the different bits of equipment that we're likely to need. Lots of wires. We use lots of wires in vascular surgery these days. And this is our pump to pump the contrast into the patient so we can see what's going on. And that's our kind of large screen that we actually operate off. So we don't look at the patient anymore when we're operating, we actually look at this screen. And that's the C-arm, which is providing the x-rays for the operation. Got lots of space in here. It's a huge operating theatre. And we've got all sorts of equipment in here, gloves, and packs to do the operations, different sorts of setups. And here we have all the different bits of equipment that we need to do vascular operations. We have all the catheters and sheaths. We can select the right size sheath to put the right device through. You can see how small these sheaths are that we actually operate through. That's the basic platform for operating. It's one of those little sheaths that we put in. We have all sorts of equipment to do. We've got filters to stop clot from going down into arteries. We've got atherectomy devices to cut through plaque in arteries, chronically blocked off arteries. We've got all sorts of stents here, various sizes and shapes. So you can see we've got a 6mm stent there on this one over here, and it's 80 centimeters long. So you wouldn't want to put it from one side of the patient's body to the other because it wouldn't reach. So you'd need a 135 to do that. So that's a 5mm stent. That's 150 millimeters long. And it's on a 135 centimeter system. We've got all sorts of equipment. We've got drug-eluting stents that allow drugs to go into the system to stop regrowth. We've got little tiny ones for the tiny tibial arteries. We've got little sheaths. We've got every balloon. And these aren't balloons for birthday parties. These are balloons to open up arteries and to open up stents inside arteries. We've got every conceivable size that you could possibly want. All the different balloons. And we've got different catheters to cross over through, difficult to cross arteries. And that's a view of the theatre from back there. We've got, this is called a hybrid operating theatre, so it's got operating lights. We can do normal operations, but it's also got this great big C-arm we can do the modern vascular endovascular operations. This is where the anaesthetist lives. He's got his own little workstation with various, the same sort of monitors as outside. A little bit more sophisticated information. That's all recorded for each operation. So that's pretty much it. I'm just going to show you outside. This is a lead shield in case people don't have their lead gear on and they want to watch the operation from inside the operating theatre. Out here we've got the anaesthetic bay where we prep the patient before the operation. So this is a nice sort of private area. Got a good light because anaesthetists often put lines in and things. We got monitors and all the usual monitoring equipment and every conceivable mask and things that anaesthetists love to use. So yeah, that's pretty much our hybrid operating theatre at the SAN. And we're halfway through an operation at the moment, so what we're doing is putting some urokinase into the patient. We're having a bit of a break while the clot busting medication's working. Here's another one of our hard-working theatre sisters, absolute expert here. Marcus, what do you got to say about the hybrid suite and how wonderful it is to work here?
Doctor.
He's not on call, he's not going to say anything. Wonderful?
Lovely to see you all.
It's good to be here on a Saturday.
Always.
Love it.
Yep.
Say hello to the people.
Yep. Hello all.